I'm a recovered alcoholic, so I haven't had a drink for coming up 12 years now. And Lola is coming up 14, so that will give you an idea of what was going on. For many years I was worried about, does she have FASD? I'd look for indicators, but I never knew for sure. And then things changed for Lola pretty rapidly when she hit high school, and I took her to a paediatrician, and that paediatrician let us know about the clinic. And I thought, okay, it's time to take it out of the dark and into the sunlight. I can't be alone with this. And so I brought Lola in, and she went through everything, and we got a diagnosis. And from then, things have really looked up.
Fetal alcohol spectrum disorder, or we call it FASD for short, is a neurodevelopmental condition, and it happens because of alcohol use during pregnancy. The way that we think about FASD is that it really is a full body condition. So at UQ we've been doing lots of research to really understand what are some of the impacts that the alcohol has, and we've found lots of things I guess that people may have not known before, and that's some of the things around the impacts that the alcohol can have on the developing all the body really, all the organs and systems of the body.
The amount of times I thought I was just this dumb kid who didn't understand how to fit into a certain society, like I'm a kid who can't, just be like any other child. And I think that's obviously the other kids in that school didn't understand, so they just picked and poked and made fun of me and said, oh, you're not a functioning member of the school. Same with the teachers, they said, well, why can't you do this? It's that easy, or why can't you just do it? I don't know. I can't do it. And now that I'm here, there's an answer to why I can't. And that's just like a relief. It's, just how I am now, and it's just how I have to live at this moment. And I'm actually a lot happier now in a different school with now an understanding mother, with a perfectly safe environment. It's a lot better now than it was last year. So certainly the clinic has helped so much.
For a lot of our families that we see, they may have been going through a long time wondering what was happening for their child. They may have been to see lots of different specialists or lots of different health professionals, and they've never really gotten the full answer. So for us, a lot of the time we hear that, we've been to lots of different people, but we don't really know what's going on. And that's because there's a lot of misconceptions about FASD, and there's still a lack of services in our community.
I would say to parents who are worried, adoptive or biological, don't hesitate. Don't hesitate. Once upon a time, things like ADHD and autism weren't discussed. Those children were hidden too, and today we wouldn't dream of such a thing. So I would say let's stop hiding young people and children who are born with FASD, and let's start bringing it into, let's start looking at it a different way. And to do that, we've got to take away the shame, and we've got to stand up and say, me too. Yeah, that, lives can be changed. I know ours certainly has. And come out of the darkness and into the light, and your life will change too, and so will the lives of your children.